So, Lauren, it's a pleasure to have you on A Skeptic's Path to Enlightenment. You and I have been Dharma friends for some time, attending retreats together, and I've enjoyed your guided meditations and the events you've organized. So it's an honor to get a chance to talk to you on the podcast. Thanks for joining us.
Thank you.
So, I wanted us to start out with a great book that you wrote that I enjoyed called The Lost Art of Compassion. And I wonder if you could talk about why compassion is a lost art and how we might regain it.
Actually, by way of answering the question, I'll start with thanking you, actually. Like,
Yeah.
'cause it was striking me this morning, like, as I was thinking about doing this, that, there are so many people in the world right now who are using technology, right, to spread misinformation or to spread craving or to spread anger or to spread hatred, which is why, is in part an answer to your question, right? Why is compassion a lost art? Is that we don't focus on it.
Mm.
And here you are, you know, and I actually thought of it this morning. I was contemplating. I was thinking, wow, I view this podcast as your meditation on compassion and love, and it like radiating out through technology to the world. Um, and so I think why is it a lost art? Is that people we don't focus on it, do we? And I'll share just briefly. Like when I was researching the book, I remember like asking people. I mean, in psychology, there was no at the time I was trained. There was no training in love or compassion, no mention of it. And then I would talk to medical doctors and nurses, and they would say, no, there was nothing in my training about that. I mean, if there's any fields that should have some degree of training and compassion, it's ones directly aimed at alleviating suffering, but it wasn't included in the curriculum. It wasn't included in our way of thinking. It's not, and one other comment I'll make is just, we such put so much emphasis on, I mean, people have called it the culture of narcissism. And, and isn't it? I mean, narcissism, I say in the book, actually, narcissism is the opposite of compassion.
Mm.
I often think that it's not, I mean, hatred is not the opposite of compassion. It's
Mm.
narcissism, right? So that what's the word? Preoccupation with self-image.
Mhm.
And our culture has gotten more and more extreme, I think, in that. But thank goodness there are people trying to share the opposite of that, including you through this podcast.
That's very nice of you to say. I appreciate that. Yeah, this idea of positive psychology was a big new idea. What was it, like 15 years ago or
Yeah.
20 years ago or something? And you're a psychologist, right? You're a trained psychologist, so you were probably kind of completing your training around the time that was emerging. Can you talk about that development, like how Western psychology overlaps with positive psychology? Like, how is it starting to work?
You're right. First of all, yeah, I was right. I mean, they were starting to do the research right when I was doing my, when I was doing my training. That the research was starting to come out, and it was really striking because I mean, the people who were interested in positive psychology, those early researchers, made a number of points. One of which was, the whole field of Western psychology grew out of what's the word? A focus on symptoms, actually. So a focus on addressing symptoms. So there was no question actually initially of what uh, about the positive aspects of the psyche. That wasn't what was addressed early on. And then after that initial part, it was part of the medical system. So a lot of the, I guess my point is, it was driven in large part for many, many years by finances, right? In other
Mm.
words, who was going to get funding were people who were going to look at addressing a specific diagnosis. And so even if you look at psychology, it was, there was a huge emphasis on creating like, the DSM-1 and then DSM-2, now we're up to
Mhm.
5, um, right, to sort of categorize illnesses. Mainly, if you look at it historically, they point out it was mainly for financial reasons, actually, to
Hmm.
get funding. And so the insurance companies would also fund therapy, and so the government agencies would fund research. And so it was actually a radical step in psychology in the West to start to say, well, wait a second, there are also life enhancing positive aspects to psychology. And if you reach those, the insight, it might actually help people, which of course is quite true. And for me personally, as a Buddhist, I was really so thankful because, our Buddhist tradition has for, you know, well, 20, over 2,000 years has focused on the positive aspects of psychology.
Mm.
And so one thing I want to share is like, So there have been this research on all different like positive mental states and what are their protective, and what ways might they protect, help us be resilient, protect us from trauma, protect us from depression, protect us from anxiety, protect us from other um, negative states, but also in what ways might they enhance our quality of life, enhance our
Mm,
well-being. And one point I would make that's been interesting for me and wonderful for me is I remember when I first started as a psychologist, I helped form a group of Buddhist psychologists in this area.
mhm,
And I remember us talking, this is early on, about like, can you really introduce meditation in
mhm,
therapy? And it was like radical, this idea. And now, of course, it's on everybody's website. I teach mindfulness and it's part of therapy.
mm,
But Buddhist psychology that emphasizes love, compassion, mindfulness, other positive mental states, gratitude, has so helped the positive psychology movement. So there's been a humongous amount of cross fertilization in the
mhm,
research and in clinical practice. Um, and for me, I use those every day. I mean, there's not a day
mm,
that goes by I don't focus in some way on people's strengths and
mm,
positive mental states as ways of increasing their sense of meaning, their sense of
mm,
purpose, and also of coping with the challenges of life, yeah, and
mm.
finding resilience.
What's a specific example of some, positive psychological method that, you've used recently with one of your patients?
I'll just give a very simple example. Just last week, I was working with a woman about conflict in her family and the very difficult interactions in a divorce context and so on. And again, the emphasis initially was on, of course, somebody's coming to a therapist. So the emphasis initially is going to be on, well, what's wrong? What are the problems? Which is
Mhm,
good. I mean, we need to do that. But in order to come to the right place, what I paused at a certain point, that focus on the problems that were going on in the family and connected back to her heart, which I knew was at the core, it's love for her children.
mhm,
And really, we paused and just focused on reconnecting away from all the stress back to the
mhm,
source of why she was talking in the first place, which is actually love. And she was able
mm,
to get back to in touch with the love she has for her children.
mm,
And then I said, let's come from there and coming up with a solution
mm,
of what are your next steps, not
mm,
strategizing about, out of frustration with other factors that were real, but starting back from the fundamental place of love and then coming to, okay, now how do you want to intervene in this
mm.
situation? And then, yeah, and a few days later I got an email, overjoyed that the thing she had come up with had worked. And
Oh,
that, and so I was like so happy. But that's an example. Yeah.
does anyone ever come to you though and saying, "I'm feeling good and I'd like to feel great?"
Occasionally, it's rare, and it's going, yeah, no, that does happen. I'm feeling very
That's
good. Maybe not great, but very good. Yeah, that happens sometimes, but it's pretty rare. Yeah,
Yeah, because that's how I've heard positive psychology described sometimes is the when you go from, okay, going from surviving to thriving or
yeah.
something like that, they say. When we were preparing for this interview, you told me that there's a number of questions you get almost every week from your patients, and I thought going through some of those would be really beneficial for our listeners because they're probably having some of the same questions. One of them you mentioned was that people ask, "What's the difference between self-care and selfishness?" You were talking about narcissism before,
Yeah.
and probably some of us might be afraid that we're narcissistic if we think about ourselves too much.
Yeah, and that does come up all the time. And I think actually people get really confused about like what is self care, first of all, and what is self compassion, and one point I would make is that's actually I mean I was aware. I mean I used to say this before the pandemic, and then over the course of the pandemic, it's become almost a mantra for myself as well as for patients. Is genuine self care and effective care for others are totally interdependent. In other words, you can't care for others if you're not taking care of yourself.
Mhm,
And and I guess what I've seen is that if somebody was confused about that, the pandemic has helped make it clearer. Because if you haven't been, if you don't take care of yourself, you can't really be there for others, right? Is one point. And so I guess so that gets to a point, I think a really important key point, which is, in my view, self care and self compassion are grounded in awareness of our interdependence.
mm,
That our well being and others' well being are completely interdependent, and that if you're effectively taking care of yourself, that leads to taking care of others. Also, if you're actually taking care of others in an effective way, it's a version of self care. It gives meaning to your life. It gives joy to your life. It gives happiness and connection. and so those are not selfish, and taking care of yourself in order to love yourself and thereby be present lovingly to others, that's not selfishness. And selfishness, I think, and narcissism come out of actually confusion, really. So I would say narcissism and selfishness come out of a confusion that denies our interdependence. So it thinks I can take care of myself in a way that's somehow going to protect me in the absence of others, and is disconnected from others. And it also denies impermanence. In other words, like a selfishness and self-centeredness and sort of narcissism deny the truth that everything's impermanent, that our well-being and others' well-being are interdependent, and so on. And what was going to make about that? So I would say, like, effective self-care is really, yeah, it's grounded in this awareness that I have to take care of myself in order to be present to others. And I'll just have one more point. Like, I often think that there's one verse in a Buddhist practice I do that I was thinking about the other day, where it said, "In order to fulfill the welfare of myself and others." And I was like, "Oh, that verse is getting at that point." In other words, and that in Buddhism they make this point: the more, what's the word is, the better you are at taking care of yourself. In other words, the more you've fulfilled your own welfare, the more you're capable of fulfilling the welfare of others. Um, and the flip side is also true. I remember one point, in my training, I read this point about narcissists, and it said everybody knows that narcissists are bad at empathy and at understanding the needs of others. And this expert in narcissism said what people miss is narcissists are just as bad or worse at understanding their own needs. And so they do things to make themselves happy that actually cause them suffering. And if
Mm.
you watch a narcissist, that's true. In other words, they try to make themselves happy in a way that actually doesn't take care of themselves. So that's the core difference also, is that self-care actually leads to your own well-being and also to the well-being of others. Self-centeredness, not only is it not helpful to others, but it actually harms yourself because you're not being realistic about what actually causes you happiness.
And what would be a good way to take care of yourself and to create a cause for your own happiness?
I was thinking about that after you and I touched bases on the email a little bit, and I wanted to almost go through, like, and I'm going to kind of put this in terms of self-compassion for a second. I was thinking about it, that they're almost like, yeah, I was almost thinking, oh, you could do almost like a self-compassion hierarchy of needs or something. And what I mean by that is that it was striking me that oftentimes when I'm working with people, the first step I think is just nonviolence. Actually, in other words, like, which is kind of an extreme point, but you can't address the deeper versions of self-compassion if you're being violent to yourself. And I mean nonviolence in the sense that Gandhi used, ahimsa, like, and because um, many, many, many people in our country, our culture, say things to themselves every single day, sometimes thousands of times a day, that are horrible. And I can't tell you how many times I talk with somebody and pointed out, they'll say something that they thought, and I'll say, imagine saying that to your best friend, or imagine saying that to your child, or imagine saying that to a coworker. And they would say, I would never say that to somebody else. That's horrible. How often do people say, I'm an idiot? What the hell is wrong with me? You're much worse than that. I'm a this and I'm a that, kind of all kinds of insults to themselves. And they sometimes think they're motivating themselves, or they think they're trying to improve themselves. It doesn't work. There's good research, scientific research showing that's not an effective way of bringing about change. So I would sometimes say the first level of self-compassion is stop saying horrible things to yourself. A second level, or another related one, is stop treating yourself. There are people who, like, so many people as well. I was just saying, I live and work outside the Washington D.C. area. I don't know if it's the same in other parts of the country quite as much, but there are often people I talk to where they'll say, "Oh, I worked 73 hours last week,"
Mm.
um, and I don't know why I'm tired or something. I don't, and I'll say, that's cruel, actually, isn't it? I mean, like, in other words, if a boss demanded you work 73 hours a week regularly, that would be horrifying. Um, and so the first thing, so those are examples of nonviolent. To me, those are kind of being violent to yourself, actually, being cruel to yourself. Then you get to very basic things that we all know. Are you actually doing the basic things to actually take care of yourself? Like, so meditation, exercise, eating healthy, so on. having social connection. The scientific research now is that loneliness is worse for your health than smoking cigarettes.
Mm.
That's amazing. You'll die faster by being lonely. And I mean, smoking cigarettes is terrible for us, but loneliness is worse for our health and our longevity. So staying socially connected would be in that list. So the second level I would say is basically like taking care of your body so that you can be present with others.
Hmm.
And then I get to the third level of self compassion, which I would describe as then starting to look at what are the deeper causes of our suffering.
Hmm.
Um, and that's what, um, you know, many Western psychological approaches address that, and also much of Buddhist psychology addresses that. And with a recognition that happiness is a mental state primarily.
Hmm. Hmm.
Suffering is a mental state. And so to actually look at your own experience and ask what in my experience causes me to suffer. And we usually, when people start out, they think it's external things,
Yeah.
but it's our mind, because our mind is the source of happiness. Our mind is the source of suffering. And so to ask, what are the actual causes of my well-being or my suffering? And actually, do you mind if I go off on a small tangent? Is it all right if I
Of
share a
course. Yeah.
brief tangent here?
Absolutely. Absolutely. Yeah.
In one way, it's a cliche to say happiness and well-being come in the mind, right? Happiness and suffering come in the mind. But actually, I wanted to share, I just maybe will briefly share a personal reflection, which came at a certain point in my own life, actually, when I was here in the Northern Virginia area, and in a given week, I was being a therapist and I was working with patients, and I would see people and it would strike me that they had everything other people on the planet want. Whereas they made much more money than I did. They were good looking. They had a beautiful house. They had an expensive car. They had an attractive spouse. They had children, and they wanted to die. They wanted to kill themselves.
Wow.
And I would go from work where I was trying to help somebody not kill themselves who had everything. Again, I was like reflecting. I traveled in India and Nepal, and I was like, oh, people there. Come across people there who would have given anything to have what these folks had. These folks had it, and they wanted to die. And then I would go, and I was at the time, my teacher, one of my teachers, Reba Rinpoche, was in the area, and he had cancer. And I was taking him to chemotherapy appointments. And one day we were sitting in a chemotherapy appointment, and I was sitting with him, and I looked at him, and I realized he was happier. He was the one with cancer, right? He was in his 80s, he had cancer, and he was dying of cancer, and he was getting chemotherapy. And I realized he was happier than I've ever been in my life, and happier than anyone I knew. And so did everybody. Like, everybody around him could tell. A nurse came up to me, and she was crying, actually, and she said, how can I meet someone like him? He's the most blissful, beautiful person I've ever
Yeah.
met. And the doctor was even an oncologist started like tearing up talking to him.
Yeah.
And that for me was a moment where I realized, oh, it's not a cliche and it's not a metaphor. Whereas happiness literally comes from the mind.
Yeah.
Like, whereas he could be in a chemotherapy appointment and blissful. Somebody else could have beautiful, could be driving from their beautiful house to a great job in a beautiful car and want to drive off the bridge. And I would realize, like, oh, it's not a metaphor. It's literally true.
The story about your patient who was suicidal is so sad. I mean, is someone in that state by definition also depressed?
Yeah, yeah, that person was certainly depressed. Yeah, no, and I think, I mean, it's an interesting question. Like, most of the time, if most people who have suicidal thoughts are depressed or have bipolar disorder. I guess it's possible. It's possible to have suicidal thoughts without depression, but most of the
Yeah.
time, yes.
And what is depression? I think it's I know there's a clinical definition, but with your understanding, being a Buddhist practitioner as well, like what is depression and how do you treat it too? From that middle way perspective where you have the psychological and the Buddhist background.
One point I'll make, actually, that actually I'll share this. But actually, that same teacher of mine, Reba Rinpoche, one day right before he left to go back to India, he said to me, he said, when people ask, be sure to tell them that if people ask you, he said, be sure to tell them, that it's good to take medical treatment and then also to meditate and
Hmm.
do both, not just one. And I found that to be a useful point.
Hmm.
And so I guess what I'll say is, actually, I'll just share. Like, I mean, there are many ways to describe depression, but one way I'll describe it is that when they did research on relapse prevention for depression, when they found that they did a wonderful research study using mindfulness-based cognitive therapy to prevent relapses. And one thing they found, and one of the things that that study found, that some other studies found, was that rumination on negative topics could bring about a episode of depression, an
Hmm.
episode of depression. And so my view nowadays has been that a person has to first of all have some predisposition to being able to become depressed. Some people don't have that predisposition, just like some people don't have a predisposition to diabetes or high blood pressure or whatever. But if you have a biological predisposition to depression, and then and this is important, and then you ruminate on negative things about yourself, about your life, about the world, eventually that rumination becomes a habit
Hmm.
and also leads to biochemical changes in the body
Hmm.
if you do it long enough. And nowadays, I mean, on a practical, there's a clinical definition of depression, but on a practical level, I would say it's so if somebody has that predisposition and then they spend enough time ruminating on negative things,
Hmm.
it induces psychological and also biological changes that have to be addressed. And that's where that research study was interesting. Was people, if they took an antidepressant, it could change the biological component of it. But if they continued to ruminate, then when they got off the antidepressant, they would have a relapse. Whereas if people learned to not ruminate and to replace negative ruminative thoughts about negative topics with either neutral things or positive things, then that would protect their biology from having another physiological depressive episode, and it would protect their mind from the negative thoughts and feelings of depression.
Yeah. Yeah, and I mean, for those of us who interact with depressed people, it could be that can seem sort of obvious, but they don't like it too much when you say, "Stop thinking about all this
No, that
negative
doesn't work.
thing." So what do you do? Like, how do you help somebody like that?
Actually, I'll share this too. I sometimes actually, as a psychologist, I sometimes differentiate two different things. The first is, and I'll use that example of, I'm not using a specific person, but many people I've seen who are like that person I described, the sort of having good things in their life, but wishing they were not alive. I think before one gets to strategies, it's important to ask, is there wisdom in their depression? On the one hand, yes, there could be rumination, but the rumination began because the person isn't actually living the life they want to live. Um, and so sometimes actually like listening to I often say that to start with listening to the depression itself and to say, does depression have something to tell you or to teach you about how you do or don't want to live? And so to me, that's often the first step is, yeah, actually trying to learn from the symptom if it has something, yeah, if it can help a person to realize maybe they want to change their life in certain ways. Um, and then after that, I think there could be usefulness in then saying, okay, what are the actual practical strategies? Because to say don't ruminate, actually, I agree, is not helpful. What is helpful, though, is to come up with what are the topics of rumination. And oftentimes people don't. I say, well, how? If I say to somebody, well, how do you not? How do you get away from rumination? I've asked so many people this question, and they'll say, watch TV,
Yeah,
or or something like that, or
distraction or yeah.
I go on Facebook or something, and I'll say, that's, well, no wonder you ruminate. Like, it'd be like that's not enough, right? And so people need actual practical, real strategies. And I sometimes say it's great to have like a whole menu of like so if I catch my, and the first thing, mindfulness actually helps people catch their rumination. To know, if you practice mindfulness every day, then you start to notice when you start to ruminate. Because once you're caught up in rumination, it's much harder to stop.
Yeah.
So if a person wants to stop ruminating, first of all, practicing mindfulness helps them catch when is the first beginning of my rumination. But then if you don't have many strategies to break away from the rumination, just saying don't ruminate is like not going to help somebody. But if they have 15 different options of how do I shift my focus in that moment, well, then they can say, all right, I'll try some of those and which ones work for me. And let's figure out which ones work best for myself. That becomes, I think, a useful approach.
Mm. Sounds like it might be a good book, 15 ways to get yourself out of depression. When you're with your patients, do you prescribe meditations? I mean, do you teach them how to meditate and how to work themselves, in this way?
I mean, first of all, I'll say my policy from many years ago is I, let's just say through. If there's a meditation that's been supported by scientific research, then yes. And one thing I don't do, unless, but I won't teach Buddhist meditations that aren't supported by scientific research unless somebody explicitly asks me to. That's just a policy thing. So if somebody says to me, "I'm curious about Buddhism and I want to learn this technique for this reason, and I think it's appropriate," then I will share that. But otherwise, I'll only teach meditations that have been shown to be effective in scientific research. But yeah, no, I often teach people techniques. I guess I'll say a couple things. The one is I'll sometimes teach a technique. Second is sometimes without even formally teaching it, I'll just use aspects of it. If I say, well, let's slow down and breathe and let's, like, so I'm not explicitly teaching a technique, but sometimes we'll actually go through a technique that's a meditation technique in the session without, I'm not saying this is meditation. I'll say, slow down, feel your feet on the floor, feel your breathing, and now let's focus on this. So that's a second way. And one last point I'll make, though, is nowadays I have so many people who come to me for therapy who are using some of the meditation apps, uh, uh, and things like that regularly and use them every day. And that's wonderful. It wasn't true 5 or 10 years ago, but it's true now.
Yeah. Earlier, when you were talking about self-compassion, you grounded it in an antidote in interdependence, trying to expand your idea of your place in the world. I don't know if you've read Robert Thurman's new book, Wisdom is Bliss, that I'm starting to read and loving, but one of his big realizations and statements in there was how meditation may not really be that useful until you have some sense of interdependence. That if you sit down and meditate, but you think of yourself as a hard, separate, unitary, solitary being outside of the world, then even if you're following all the instructions, it may not be of that much benefit. And can you talk a little bit about that? Because I think that aspect of Buddhist meditation practice isn't always included in these therapeutic approaches to meditation. So can you talk a little bit more about that interdependence, wisdom, and um, how that can get into helping our delusions?
Yeah. I mean, well, first of all, I totally agree with that point. And I guess I'll say, I think, well, actually, I read the book, and at one point that Bob Thurman was making was that, which is a very Buddhist point, but it's true, and it's true, is that, if we're not aware of, actually, it's true, isn't it? Like that, well, actually, I guess I'm going to step back for a second. What is, actually, if you think about it, what is meditation, actually, right? And, the Buddhist definition of meditation and the popular culture's definition of meditation are not the same, is one point.
Hmm. Hmm.
Uh, and even in popular culture, what is meditation? And I just think that's worth asking as a question to actually contemplate. What do we mean by meditation? And so it's an interesting point. Like actually, I'll share a reflection here. Like, I sometimes say, like focusing on mindfulness of the breathing, which is what some people mean by meditation. I sometimes think in our, we've studied the Tibetan tradition. I sometimes say that's like stretching in the context of the Olympics.
Hmm.
Like, in other words, so all the athletes stretch, um, but that's not one of the sports.
Yeah, they don't give a
Which
medal for it either.
No, you don't get a medal. And so mindfulness of breathing is not all we mean by meditation. That's like a warm up, actually, in general, for other meditations. Oftentimes, it's not always, but often is. So that's one point. And then another is, I think what Thurman was getting at in his book was meditation is habituation in a way to something, habituating to mindfulness of breathing, or habituating to love, or habituating to compassion. And if somewhere deep down you're holding on to some kind of wrong understanding about yourself, then if you dwell on that in meditation, you're actually strengthening it.
Yeah.
And that becomes the problem. And so, for example, if somebody approaches meditation from a narcissistic perspective, right? And then they are sitting there meditating, and somewhere, maybe they're focusing their breath, but if deep down their focus is actually a kind of grasping at their self-importance, then their meditation is reinforcing self-importance, which is not the goal of meditation, but that can happen. And so I think that's what it's getting at, is to recognize that we have to kind of, what's the word, be aware of and work through those, or our
Hmm.
meditation reinforces negative habits.
Yeah. I don't know if you remember The Onion, his satirical newspaper, but
Oh yeah.
it was easily 20 years ago where they had a headline that said, "Monk gloats over yoga competition. I am the serenest."
That's funny.
I found that so funny, but it's actually very relevant. It's a very relevant problem with meditation or even yoga.
Yeah.
With this idea of the self and others' interdependence, another question you said you get a lot is about boundaries. of how we set healthy boundaries, how that contributes to a healthy mind. I'm also curious if boundaries are different for a Buddhist who's trying to have love and compassion for all beings and a quote normal person. So it's a big topic, but could you talk a little bit about boundaries and the kind of challenges people have with them and some of the antidotes you help people with?
Yeah, this is a topic I've thought. Well, one is again, there's not a week that goes by where that doesn't come up in therapy. But also, I've thought a lot about this in terms of a Buddhist view on that topic. And what I realized was that the only context in where Buddhist texts use the word boundary is in the context of retreat. They'll say, "Set up your retreat boundaries." But there's something in that, in a sense that, and I guess, and as I've looked at Buddhist teachers and Buddhist teachings, actually, they don't use that term in other contexts that much, but it's actually humongous. It's huge there. I mean, there are all kinds of boundaries in Buddhism, actually, humongous numbers of them. And and actually, I guess I'll say this: like, I think actually, first of all, I think boundaries take courage. Is one point I would make. Setting boundaries takes courage because people don't always like it when you set boundaries, right? Um, and also you're having to admit your own limitations. And actually, I'll just start with this. Like, I'll start with about the courage point and admitting your own limitations. Take the example of the life story of the Buddha, right?
Hmm.
The Buddha was a prince. He was married and had a young child. His father wanted him to take over the kingdom. And he set a humongous boundary, right? He said, no, I have to leave home. I have to cut my hair and give up my kingdom to pursue inner development, right? To pursue enlightenment. And what a boundary. Like,
Hmm.
that's the most, I mean, that's as radical about, right? It's incredible, incredibly radical boundary, right? And what courage that would take, right? Like, in other words, at that moment, he knew very well his father, his wife, his child, they didn't like, no, none of them liked that boundary. You can imagine.
Hmm. Hmm.
And I guess, and the reason I bring that up is we all in our daily lives, when we set boundaries, are going to have people who don't like it. But a boundary, my view is where it comes from is this, is I sometimes say to people is if you get angry, that's a sign you need to set a boundary and you haven't set it yet.
Hmm.
Um, because you're not admitting the truth actually to other people of where your own limit is. And so boundaries are about recognizing, taking care of ourselves actually, and recognizing I'm going to get frustrated, or I'm going to get angry, or I'm going to get irritable unless I stop at this point, or unless I ask another person to stop at this point, or step away if they're going to go beyond that point, because I'm not, and sometimes I think for Buddhists, we're actually worse in the sense of I sometimes think like sometimes I've noticed is like myself included that sometimes we Buddhists um, can be phony actually.
Hmm.
Like is not admitting like there's this ideal of patience, which is the goal, right? I mean, the goal of bodhisattvas become incredibly patient, but to say, well, I'm not that patient yet, and so if I'm going to take care of myself in the sense of not take care of myself in some narcissistic way, but take care of myself in the sense of my mind, right?
Hmm.
Then I have to avoid certain situations where I'm going to get overwhelmed and become irritable or become angry or become impatient or become, and that's part of the practice. And it doesn't mean that someday I won't go beyond that and be able to engage in that situation. But it's actually, so boundaries are about like, if I'm going to lose my love, for example, right?
Hmm.
Then I need, and if I go this far, if I go this far, I'm going to lose my love. Then I need to stop here, right? And it's admitting that to ourselves and then asserting that with others, which takes bravery and courage and honesty.
Hmm. Yeah, I've gone through that myself, especially in my relationship because I think, in our tradition too, there's a sense of like fake it till you make it, where you try to like pretend that you have compassion. But like I found I fall across the border sometimes into denial or bypass, which is really, really harmful.
Yeah.
So yeah, I think the more conventional forms of like couples, therapy and psychology have helped a lot just to be quite tender and honest, with my partner and say like, "Hey, I'm starting to feel really angry about this thing," or like, "Hey, I want to spend some more time with you," or what, these places where you're quite vulnerable and maybe you admit a need. I think it's hard as a Buddhist because in some ways we're supposed to just be happy with the pure nature of our mind or something like that. But I don't know. It's okay to, want to be loved and and be embedded in the social reality and so on. Do you see that ever in some of your
It doesn't. I
experiences?
mean, I think that's so touching what you just shared, right? Because it's that, and I actually think, what's we say? Right? Yeah, I actually think that if we don't do that work, then it's not, like we're actually. I guess I'll say it this way, like, oh, well, our mutual teacher, Guy Tenterm, made a point
Hmm.
that there's a like, which is, let me just say it the way. I guess I'm going to say it this way. There's a difference between artificial. There are different terms in Buddhism for this, but there's like spontaneous compassion. Then there's compassion that takes effort to cultivate, and that's good. Whereas if you can create effort and create compassion, but pretending to have compassion is not useful. And I've made that mistake so many times. Like where it's like so in other words, if it takes work to come to real compassion for somebody, that's good work. But pretending to be compassionate has no value at all. It's not actually a practice at all. That's a version of narcissism, actually, isn't it? Like, and that's where we like co-opt a kind of fake version of, and we all do it, I think, where we co-opt and create a fake version of Buddhist practice. And actually, I'll just share one more point about that. I remember, this many years ago, I was when I was in graduate school, I was like working with people with autism spectrum disorders, and I was doing graduate school, and I was like very busy. And then I read this quote from one of my teachers, Lama Zopa Rinpoche, and it said, "When you begin to cherish others from your heart," I'm not going to forget the exact phrasing, but basically he said, "When you begin to cherish others from your heart, uh, pure joy arises." And I remember at the time I thought, "What's he
Mm.
talking about? I'm totally stressed out. I'm like, I'm trying to do graduate school. I'm not feeling joy at all." And then I had to stop and realize I I was doing things that looked kind. I was studying psychology. I was working with
Yeah.
people, but I was so stressed out that I wasn't actually feeling love, cherishing others in my heart, and therefore I wasn't having joy. And genuine love and compassion bring joy. So that's one thing. It's been a measure for me ever since. Is if I'm not
Mhm.
feeling joy, then my love or compassion are not love or compassion. There's something else. I'm deceiving myself.
I
Yeah.
yeah, it's a very, very subtle point and powerful point I think you're making, that just to repeat it, like fake compassion is a form of narcissism. I think that's and I say it rings true from my personal experience, but then effortful compassion is beneficial, and then spontaneous compassion, is amazing
Yeah.
if and when it occurs. But then what do you do? Yeah, I think that's why it's kinda helped me to fall through to actually just being honest about my feelings, like you're saying, like, that's a kind of reasonable boundary, is, like, instead of pretending that you're just filled with love and compassion, to say what you're really filled with in a way that's not obviously insulting or hurtful, but just honest from your own side. Is like, this is what I'm feeling right now."
And that's courage,
Mm.
isn't it? I mean, I think that
Yeah,
takes courage. And that's what I was saying about bravery or courage is that takes courage, right? To be real.
yeah. Hmm. Oh, very, very nice. Another question we talked about was actually kind of a funny one. Was about pleasure. We've been talking about problems, which is normal. Again, it's psychology, but sometimes we feel guilty for enjoying things. So I'm curious if you can talk about what you do with pleasure. From a psychological and a Buddhist psychological point of view. Like how does pleasure become beneficial? I mean, we talk about the escapism of watching TV but is there a beneficial way to engage in the various pleasures of life?
I want to give two different answers, I guess, or maybe more than two, but I'll start with
Hmm.
like a Western psychological point, which I think is
Hmm.
very relevant,
Hmm.
in general, which is in Western psychology, we sometimes talk about affect regulation or emotional regulation.
Hmm.
And that, that we need, um, again, like I often say to people, you know, in the context of therapy, what are the range of things that bring you emotional regulation and happiness and contentment and joy and peace? And and if people have many people have a very short list, of those
Hmm.
things. And so one point I would make is what happens then is that our emotions get dysregulated. As a psychologist, I would note our
Hmm.
emotions then end up getting dysregulated. If you don't have things that bring you peace and joy and contentment. And then eventually, Shanti Deva in his guides to the Bodhisattva's way of life says, hatred grows from unhappiness.
Mhm.
So then we get unhappy. And if we're unhappy, we're stressed out. And we're stressed out, then we eventually get irritable. And then we become angry. And then we become resentful. And then all these other things, all these other negative states arise.
Mhm.
So one point I would make, a very simple point, is if there aren't simple pleasures in your life, or yeah, then and ways of sort of finding contentment and joy, then you're going to become dysregulated. You're going to be a negative presence in the world. That's one point. And then another point I would make, I was reflecting on this after we spoke, and I was like, you know, of course, like people sometimes know, the first noble truth is the truth of suffering in the Buddhist context, and the Buddha's, but that's not, that's a diagnosis. It's not a prescription. In other words, the Buddha wasn't prescribing suffering; he was diagnosing it. Right? He was saying ordinary
Right.
people suffer, and we suffer all different ways. But then I was reflecting, like, actual Buddhist practice and the path is all about joy. And again, I quoted Shanti Deva, or I paraphrased them. And Shanti Deva says the Bodhisattva goes from bliss to bliss, or from joy to joy. That's the nature of the Bodhisattva's way of being in the world. And I was contemplating that the other day, and I was thinking, like, because I already said, like Lama Zopa Rinpoche's quote, right, that when you cultivate love, immediately joy arises. For me, when I think about that, and this is just the most basic level, right? As I often think back to when I was a kid, and I would go to see my grandparents, and I would get off the plane, and I think of their faces when they would see me. I would come around the corner off the plane, and they would look overjoyed, and like so happy, and like running over, and like they were getting the joy of love.
Yeah.
I could see on their face that experience, and it's their love gave them joy. I mean, I was the object of it as a little kid,
Yeah, yeah.
and I'm like, that's the and like, so one level of joy also is like, the pleasure comes from that, right? And like, bodhisattvas love more and more. So like, they're in love with everybody. So they're like I'm like, wow, a bodhisattva walks around all day like my grandparents at the airport. Everybody they see, they're overjoyed.
Mhm.
And then there are other kinds, and then I'll just share one more reflection I was having, which is like, like, have you? You've probably had this experience too, but I mean, in the Buddhist context, I was like, where like there are these long discussions about kinds of bliss, and like, I'm talking about like in the Sutrayana teachings and the Tantric
Mhm.
teachings, all of those teachings, like they teach this kind of bliss and that kind of bliss, and there are 16 blisses, and there are 7 levels of
Mhm.
bliss, and there are 8 blissful states, and I was like, wow, we don't even have the language for that. Like,
Yeah.
in our culture, we don't even know what that is. Like, as we don't have words, and like we try to, as Buddhist translators, they try to come up with words to capture what are these, and like, so we don't, in the terms of positive psychology, we don't even know about, like, they're like, so the Buddhist practice, like, my point, I guess, is, as a Buddhist, you're supposed to have bliss, actually, and that's
Yeah.
not just the tantric, that's not just the Vajrayana teaching, that's true in the Sutrayana teachings.
Yeah, yeah.
Like, the goal is to live in a way that's totally blissed out. So
Mhm.
anyway, so I think there's huge room for pleasure in both psychology, Western psychological analysis, and also Buddhist. Bob Thurman's on this makes a funny point. He says when people are too happy, then some, like, actually, I've had patients come to me and say, "Am I manic?" And I said to them, "You're in love. What are you talking about? You're not manic." You're like, like people pathologize, over pathologize. I'm like,
Yeah.
we're supposed to be blissful sometimes, more of the time. Our problem is not that we're not joyful enough.
And especially these more advanced people like our teachers who are went through hell literally in their lives and yet are happier than anyone we've ever encountered. But it doesn't make it isn't commonsensical, I think, for the average person to say, because you mentioned the bodhisattva, right? And a bodhisattva is a being who uh, dedicates all their effort forever to benefiting others. So it doesn't, I don't think for everybody it immediately follows that giving up all thoughts of yourself it will lead to the greatest happiness you've ever experienced. Could you unpack that a little bit and explain kind of why that's true?
Yeah, I guess what I'll say is, like, actually, I think we all have little bits of that. Like,
Mhm.
so I just want to share, like, if you think of, I'll give 2 different examples. Like, if for anybody who's sort of listening, one example would be like, on somebody, if oh, well, I'll give an example. A couple days ago was my partner's birthday.
Mm.
And I kept trying to think, like, I was contemplating what would bring joy, like, and I was getting so much. It was so fun to come up with what can I give her that will really make her day, you know. And then I came up with a few ideas, and what I realized was like I couldn't tell who got more joy out of it. I mean, she was very joyful. I hit the mark, but I got at least as much joy as she did. You know, and if you watch somebody on, like, if you watch a parent, if you are a grandparent or a parent, you know, at a holiday, right, when they're giving presents to their kid, and if you watch the kid's face, that can be fun. But if the kid's really enjoying it and you turn to the face of the person giving the present
Yeah.
and you see the joy on their face, like, that's the bodhisattva. Like, bodhisattvas have that, only more so.
Yeah.
And then the other example I sometimes think of is, I think back the first time you fell in love and the kind of blissful experience where you forgot yourself because you were
Mhm,
so
mhm.
madly in love with somebody else. You know, so you can think of these little moments, like, or that's not a little moment, they're all significant moments. But for most of us, those are like time limited. And then you think bodhisattva lives in that person who's just first falling in love, or like the person who's giving the gift on a
Mhm.
holiday morning. They're like that every day. I think that's a way of starting to relate.
Yeah. Yeah, the joy of giving.
And again, it's that other care is also self care, right? If you're
Yeah.
really taking care of others, you're taking care of, right? It's not like some kind of, we think of like, I think the language is actually very confusing when it says bodhisattvas don't worry about their own well-being, they only worry about the
Yeah.
welfare of others. We think that means like they don't eat, or they like
Yeah.
don't sleep, or, and what they're talking about is not that. What they're talking about is like, you know, like when my grandparents were looking at me or whatever, when I was giving the gift, or like, I wasn't thinking, oh, will she think I'm great because I'm giving her this gift? I was thinking, oh, I really want her to like be happy, you know?
Yeah.
Uh, and of course, that makes oneself happy. That's what they're getting at. It's not some kind of self neglect.
Yeah, I've also started to feel this recently as people's masks are coming off. I've just started to see with my own mind what a big deal it is to see people's smiles,
Yeah.
because the smiles have been masked, and we don't have those signs of whether we are bringing happiness to another person. You can see little crinkles in their eyes or something, but I just notice how much my own mind is transformed.
Oh, what a beautiful point.
There's this term engaged Buddhism that Thich Nhat Hanh coined for Buddhist work that benefits the world, and I think your work as a therapist for sure fits in that category. But I wanted to ask you if you think there is some uniquely Buddhist way of benefiting the world. Is it the same whether you're Buddhist or not, or from the Buddhist psychological worldview? Are there different ways that we engage and help others?
First of all, I think this podcast is an example of engaged Buddhism for sure.
Thank you for saying
Uh,
that. I think that makes you happier than me even. Just like when you said it earlier, no, because you know how that is. Sadly, I'm not a bodhisattva, so for me, I have self-critical thoughts. Oh, that's really nice, but then I see how sincerely you really 100% mean it. So it's
yeah,
like
totally.
something that
Yeah, it
makes
brings me
me
great joy to see
something
it.
makes
You know,
me happy. I remember one of our teachers saying, "Oh yeah, it was with one of my teachers. I won't say who it is, but I told my teacher how much I appreciated their qualities and how wonderful they are." And then the teacher said, "Well, it's your virtue to see it that way. Like, I'm so happy that you see it that way." And I'm so happy for you. Wow, that is a very wise answer, because the teacher is like a Western teacher who knows how they see themselves, but just to appreciate that I saw them as a perfect teacher.
I get it. Yeah. Yeah, in terms of your general point, though,
Yeah.
actually, I'll share something which is like over the last, oh gosh, year or so, year and a half, maybe. I was thinking about that question a lot, and I started realizing that, like, I was thinking back about like some of my you know, people I just have great respect for in Buddhist
Mhm.
history, for example, who had, you know, humongous positive impacts on their society that they were living in. And one thing I started realizing in terms of engaged Buddhism is that, and I had to really put it in context, as that as a for myself, as a, you know, white middle-aged American male, who's liberal also, it was easy to project onto what they were doing my assumptions and my
Mhm.
cultural
Mhm.
biases. And then as I really thought deeply about it, I thought, oh, there was what they were doing and what I think of as activism or social engagement aren't quite the same. And what I started realizing was that, like, oh, I say it very way, like, this is my own reflection recently, is that, you know, like a Buddhist worldview, right, is that as long as people have mental afflictions, right, hatred and um, craving and greed and so on, then the world is going to have problems.
Mm-hmm.
Um, and I guess what started to strike me was that as I look at like the history of Buddhist engagement, when it's at its best anyway, I think that usually what it's actually about is trying to create contexts that are peaceful enough and safe enough so that others can practice the path,
Mm.
right? And that because like there's not, I don't know, like I think we have a certain idea of what is like what, in our cultural context about what is the goal of engagement. And I'm not sure Thich Nhat Hanh's idea was the same as
Mm-hmm.
what um, and I think our ideas come in our own cultural context and subcultural context. But anyway, I guess my broader point is, as I've been contemplating this, I actually think that really in the Buddhist context, isn't it? Engagement would be main, and this is why I say what you're doing, I think of as engagement, is
Mm.
that engagement is about helping individuals, isn't it? Because it's always individuals. There is no, it's helping individuals to gain a little more understanding of their own mind and to replace some ignorance with wisdom or to replace some
Mm-hmm.
selfishness with love.
Mm.
And that in a Buddhist context, that's the only way to make the world a better place.
Mm.
Um, and giving opportunity, so I was like, because like I was thinking about an example, like some historical examples of Buddhist masters who helped stop wars or stop
Mm-hmm. Mm-hmm.
conflicts. And I was like, they were wise. They knew there was going to be another conflict. There was going to be another war. It wasn't going to be some permanent solution. But what they were trying to do actually was create context. One is where people weren't creating horrible suffering for each other and negative karma with each other. But the other is to create context where maybe for a while those people would practice something good and learn to practice love, and therefore those people would be better, and then the world would be that much better.
Mm.
But I think it's quite a realistic view in a way, whereas I think sometimes my own views in the past have been pretty unrealistic.
Yeah, you make me reflect a little bit on how today there's a bit of going back in time and judging past heroes against new, revised, mostly liberal
Yeah.
standards of behavior. But you make me think there might be a whole other way of doing that without criticizing that at all. There's very good reasons to do that. But you make me think there's another side to that too, of going back to think, wow, despite this person's bias and patriarchal attitude and so on, look how much good they managed to do still.
Yeah, because isn't it
Yeah,
like,
yeah,
was there room for them to actually cultivate in themselves or help somebody else to cultivate
yeah,
actual love, for example, or actual
yeah,
compassion or
yeah,
actual wisdom?
yeah.
Because we all have our blind spots and faults. And
What is there anything else you might want to add before we close off the interview?
the only thing, to be honest, is just like my own feeling of appreciation that here we are trying, right,
Yeah.
in ourselves and in the world to focus on things that have meaning. And that I'm going back to what you said earlier, which I found very
Mhm.
touching, which was the honesty thing, to be honest with oneself and with others. And I guess my point is, like, just hope that from this people take that away, the sense of pause and be honest with yourself and ask what matters, and what's actually worth your focus. We've talked about many different things, right? Like, but for people to answer that for themselves, like what's actually worth their focus, and what's the truth for them in that moment? How do they actually feel? And then what do they actually want to focus on? That
Mm.
gives their life some sense of, or at least this day, some sense of genuine meaning to them. I hope that's what comes out of this.
Yeah, talk about taking control of your life, taking control of your mind. Right.
Yeah, and yeah, where your attention goes. That's something we can control to some extent,
Yeah.
isn't it? Where we put our own attention, and nobody can
Yeah.
force us to attend to things we don't. We can make, but we make good or wise or unwise choices. We all do.
Yeah. Yeah. So, actually, on that note of where we put our attention, you've agreed to lead a meditation for us, which will air in the next episode. Do you want to talk a little bit about what that meditation is before we say goodbye?
Sure. Yeah. What I was thinking to do is a meditation. Actually, that comes out of this discussion to some extent on I guess well, people will see, but the themes will be connection,
Mhm.
gratitude, warmth, and it's both about what I want to actually hope to focus on is a felt sense and a real experience of what it's like to both receive and give love. And
Mm,
and as I said earlier, like self care and other care are interdependent, and receiving and giving love are interdependent. And so to just like to connect experientially to that sense of what it's like to both receive and give love, and that
mm.
those, you know, yeah, that if you want to receive love, the best thing to do is give it. And if you note your actual receiving of love, that will also enhance your ability to give it.
Mm.
So it's a meditation on that. Yeah.
Beautiful. All right. Well, thank you so much, Lauren, for um, agreeing to do this interview and giving such honest and helpful answers. I really appreciate it. I think people are going to enjoy it a lot.
Well, thank you for such a heartfelt discussion.